The term heart disease refers to all those diseases that affect the heart, both functionally and structurally. Among these, we find pathologies that alter the heart rhythm, the functionality of the heart valves, the blood flow to the heart, the structure of the myocardium, but also congenital heart defects or heart infections. According to data collected by the Ministry of Health, among the most common and serious forms, we find ischemic heart disease, such as heart attack and angina pectoris. To find out what the warning symptoms of a myocardial infarction are, I leave you the video I made above. Symptoms of heart disease depend on the type and extent of damage to the heart and can vary from one person to another. Let's see what are some alarm bells that can be a sign of heart disease. Dyspnea. The term dyspnea indicates a sensation of difficulty in breathing, where you are unable to take deep breaths and you feel what is called air hunger. Dyspnea is one of the main symptoms of cardiorespiratory system pathologies and derives from the difficulty in gas exchange that occurs in the lungs, in particular between the blood present in the capillaries and the air contained in the pulmonary alveoli. Among the heart diseases, the one that most frequently causes dyspnea is undoubtedly heart failure. It is a condition in which the heart is unable to properly pump enough blood to meet all of the body's needs. Heart failure occurs as a result of a deficit in the contractile capacity of the myocardium, following a weakening or damage to the muscular walls of the heart. Cells, tissues, and organs will not get enough oxygen and nutrients to function properly. That's why shortness of breath, dyspnea, and wheezing are among the most common symptoms of heart disease. Palpitations. Heart palpitations are a rather frequent disorder and are caused by a rapid heartbeat. They can occur both at rest and in motion and can be felt in the throat, neck, and chest. The Italian National Institute of Health points out that if they are infrequent phenomena, lasting a few moments, there is no need to worry, while if other disorders appear associated with heart disease and palpitations occur more frequently, it could be the sign of a serious heart disorder, such as cardiac arrhythmias. These are alterations in the heart rhythm or heart rate, that is the number of beats the heart makes in 1 minute. Among the cardiac arrhythmias we find bradycardia, that is when the heart beats more slowly, below 60 beats per minute. Tachycardia, that is when the heart beats too fast, exceeding 100 beats per minute. Finally, we find extrasystole, an arrhythmia in which it is not the speed of the heartbeat that is altered, but the rhythmicity. In this case, the electrical impulse that causes the heart to contract occurs either earlier than the regular cadence of the normal cardiac cycle or originates in a different area from the sinus node. Chest pain. Chest pain is one of the characteristic symptoms of myocardial infarction, but also of a heart disease in general. In the first case, it manifests itself with an oppressive or constricting pain that if it lasts for more than 15 minutes, or if it extends to other parts of the body such as the arms, back, or jaw, or if it is accompanied by other disorders such as wheezing, nausea, and sweating, it is important to call an ambulance immediately. If, on the other hand, the pain is not strong and disappears in a short time, it could be a symptom of heart disease. It is therefore important to consult your family doctor to understand the causes. It could be the sign, for example, of coronary insufficiency or coronary artery disease. That is a disease of the coronary arteries. That is the blood vessels that carry oxygen-rich blood to the heart muscle. Chest pain may not even be related to heart problems, but to gastroesophageal reflux, to the stretching of a muscle of the rib cage, costochondritis, that is an inflammation of the cartilages that join the ribs to the sternum, an anxiety attack or panic attack, but also from some lung diseases such as pneumonia and pleurisy. Swelling of the legs, feet, and ankles. Swelling of the legs, feet, or ankles is the result of an accumulation of fluids, especially lymph. It is a liquid that circulates in the lymphatic vessels and has the task of collecting waste substances and transporting them from the periphery to the purification organs, such as the liver, lymph nodes, kidneys, and lungs. An overload of the venous circulation in the legs manifesting as edema can be a sign of a heart disorder, such as early heart failure. This is because the heart pumps blood less efficiently, that circulating more slowly begins to stagnate in the legs and ankles, causing swelling. Another cause could be venous insufficiency. That is a pathological condition in which the blood from the veins has difficulty returning to the heart after reaching the lower limbs. In addition to the swelling of the legs, feet, and ankles, there will be a sensation of heaviness, pain, and tingling, as well as the appearance of varicose veins and capillaries, which become visible on the surface. Syncope, known in common parlance as fainting, is a sudden, temporary, short-lived loss of consciousness followed by spontaneous awakening. It occurs as a result of cerebral hypoperfusion, which is when only a portion of the blood that it needs to function properly reaches the brain. This transient drop in cerebral blood flow may be due to a heart problem, including structural heart disease of the myocardium or heart valves, or due to cardiac arrhythmia, particularly bradycardia or ventricular tachycardia. The latter indicates a rapid heart rhythm originating from the ventricles, that is from the two lower heart chambers, and which exceeds 120 beats per minute. It is one of the most common and most dangerous arrhythmias, as it can degenerate into ventricular fibrillation, where there is an uncoordinated sequence of very rapid and ineffective contractions of the ventricles, which are therefore unable to properly pump blood around the body. It is a medical emergency that can be fatal if someone does not intervene promptly with a defibrillation of the heart, that is, administering a shock of electric current in order to restore the normal cardiac cycle. If you notice one or more of the symptoms described, it is advisable to contact your doctor in order to undergo the necessary tests to find out the causes and then receive adequate medical treatment. Furthermore, most people only go to a cardiologist when they experience symptoms, but this is wrong. Many heart diseases do not cause particularly evident symptoms, except when a negative evolution is already underway, which perhaps could have been avoided with correct prevention. According to experts, it is advisable to carry out a thorough cardiological examination at least every 5 years starting from the age of 40, as it is able to highlight problems whose existence was not even suspected. However, the frequency of checks must necessarily increase or begin already at a young age in case of symptoms or if certain risk factors are present, such as hypertension, diabetes, obesity, high cholesterol levels, and in the presence of family members with cardiovascular disorders.